Hello, I'm Dr. Tammy. Welcome to our video today. Welcome, my YouTube subscribers. If you have not subscribed yet, I encourage you to subscribe to my channel and you will get notifications of when I'm uploading a new video or when I go live. I would love for you to join me on a live streamed video. I love the interaction and I welcome your questions because that's the beauty of being live is I can see you and I can, well, not see you, you can see me, but I can get your feedback right away. So I am Dr. Tammy. Like I said, I am a clinical psychologist and licensed marriage and family therapist. And I have been involved in this field for many years now. I love what I do. I do work with clients and patients and help people with relationship problems or mental health um, issues. Everything from helping them with depression, diagnosis depression, anxiety disorders, um, DID, which is dissociative identity disorder, trauma, um, thought disorders, on and on it goes. So I have worked with, I would say, predominantly more folks who have experienced depression and anxiety and trauma. I would have to say that's the vast majority of the folks I've worked with. Those, and I'm going to adjust my camera, so my apologies. There we go. Those tend to be our most common mental health uh, diagnoses or disorders. Now, I mentioned on our last live video, I held up a book in front of you. I have it here, but I held it up, and it's the DSM. It was a purple book, you noticed. And it's the fifth edition, the DSM, which I explained. You can go back. It was on it was on our short video. So go back and look at my videos. It's under shorts. And I talk about the DSM just briefly and how it is our manual in the field. Many of you, in fact, I had to ask my husband this. He's not ashamed that I would share this, but that he also has had depression most all of his life and has had to receive treatment for that and medications. And so I asked him the other day, it occurred to me, I said, honey, have you ever heard of the DSM? And he said, no, not before you, not before we were together and I'm in the field. And so he's become very familiar with the DSM because of the exposure through me. But he had never heard of it. And yet he had dealt with depression for many years, had been to therapy, psychiatry. Most people do not know about the DSM. And you don't really need to know about it, but I think that it is important because many folks have asked me and still ask me, Dr. Tammy, how is it that uh, people are diagnosed? So where does that come from? Where does a mental health diagnosis come from? It comes from the DSM, and that sets the standard. So it's like the ICD codes, ICD-10 medical codes for medical diagnoses, right? I've worked with physicians. If you have or you know about any of that medical transcription or anything with insurance, you know that that medical conditions are given a code number as well, and within that code, within that number, there is a description of what that is. So it's very similar for us, and we have these codes, and there is also an ICD-10 code attached to that as well. So we would have two different numbers attached to a specific diagnosis, a mental health diagnosis. Now, I know this may be way too much information, but this is important for you to know where clinicians and physicians come up with their diagnoses. So we look at a set of symptoms and presenting symptoms, history. We will do of course, an intake, an interview, and collect background data, things that may have been going on for you, family history, on and on. And then we will put all that together, and that may include some psychological testing, psychological evaluations, And those things will come together, and then we will come up with a diagnosis based on the DSM, and that is where it comes from. Now, it's, like I said, not important for you really to know or to have a DSM, but just so you know, that's where, there are categories, and there are symptoms and everything that we consider, that we classify as a diagnosis. Now, in all honesty, it really is not that important for you to really know what that diagnosis is, in terms of the DSM. But for yourself, it is very important for you to understand what you may be dealing with, what is going on for you personally. And if you have a diagnosis such as depression or anxiety or some other disorder or thought disorder, it is important for you to understand, because the more you know about your diagnosis, then the more you can do about it. The more you can take care of yourself, the more you can reach out to resources, and it will just direct you. It's kind of like if you ever had something going on with you physically and you are frustrated because you've gone through the testing. My daughter went through this not long ago. Very discouraging, couldn't figure it out. Finally got the diagnosis and was like, I mean, it's not a diagnosis we wanted, but it was a relief to finally know what was going on with her. Therefore, she could move forward with medical care, and also her own dietary needs and things like that. The same is true with our mental health. Our mental health is just as important as our physical health. And for us to understand our mental health is just as important for us to understand our physical health. Okay, they go together. And so you go in for appointments for physicals. I just went in for a yearly physical. You do all those things you need to do to take care of yourself. You go into the dentist, you get your teeth cleaned, you take care of your teeth. But somehow we neglect our mental health. Or if we're having symptoms, we don't move forward in the direction of finding out why, what those symptoms are, what they mean, and further getting to professional help where we can get answers. I want to encourage you in this video how you can manage your mental health, specifically with anxiety and depression. Because, like I said, these two are the most common diagnoses that we see. They affect more Americans than any other diagnosis we have in that DSM. Okay, so and unfortunately, the numbers have risen dramatically with depression and anxiety. And that includes for our younger people. A recent study came out that 1 in 3 girls, teenage girls, 1 in 3 have thought about suicide. That's been within just the past several weeks. That is staggering. That is unbelievable. But it's true. It's, these stats are out there. You can find them for yourself. There's through the CDC and our mental health associations. But the point is that with so many people suffering, and possibly yourself, there is no reason for us not to be aware and educate ourselves and understand, what is my diagnosis, or what is my, what's happening with me, what's going on with me. I'm experiencing these symptoms, and they can be debilitating. They can be absolutely debilitating. And it can stop us. These symptoms, which could be different types of anxiety, depression disorders, they can stop us from moving forward in a direction of accomplishing and it's succeeding at things in our life that God may have for us. Um, so it's really important that we understand what is going on with us. Okay, how do we do that? Well, like I said, we need a clinician or a physician to diagnose us. Not just any clinician or physician, okay? We need to think about diagnosis with a psychiatrist. A psychiatrist has been to medical school, so they are a medical doctor, but then they have gone on for 5 years, I'm sorry, 4 years of residency. So psychiatric residency, and all those years are devoted to psychiatric training, mental health, or a clinical psychologist, a doctoral level, who can diagnose and also administer your psychological evaluation, some tests that can really help to tease out what further could be going on. Now, your therapist, a master level, a MFT or LPCC or social worker, they too can diagnose. Um, those aren't necessarily their strengths, but they could do that for you. And if they're comfortable and if that is within their scope and their training, they can do that and they can help you understand what is going on with you diagnostically. Do your own reading. So, after you've been given this diagnosis, after you do your reading, you do your research on what diagnosis you've been given. So, let's say you have been having depressive symptoms, and you go in to see the psychiatrist and you get a diagnosis, which personally I would recommend you doing. That would be very good for you, but I can't make any of those recommendations um, in this setting. But I would encourage you to educate yourself. So you go in, you get your assessment, you go see your doctor, and educate yourself. Educate yourself. That is the beginning of managing your mental health. Just like I said, if you have something going wrong with you physically, I would say go to your doctor. Go to your doctor, go to your physician, get checked out and find out what's going on with you. That is very important. And then you can understand where you go from there. Well, the same is true with your mental health. If you are finding that you are down most days, you don't have energy, you don't have an interest in things you used to be interested in. So, no pleasure, you just have no interest to do things. This is important to pay attention to because you could have some depression going on. So, get to your physician and then you educate yourself. There's plenty of information. If you are on any sort of medication, find out, read, research. Very important. This is the beginning of you learning to manage your mental health. And then the second thing is you want to make sure that you do have a therapist, that you have someone you can work with. Depending on the severity of what's going on with you, will depend upon how often you go and what type of approach. But there are some wonderful professionals out there, and you can really make great headway and get to a place where you are no longer being hindered by your mental health. You can actually learn to manage it. Knowledge is the very first thing, my friend. You've got to read. There are a lot of great texts out there as well. But what I caution you about, whatever you look up online or textbooks through Amazon or a brick and mortar like Barnes and Noble, make sure that the person is qualified. So whoever you are getting your information from, have that same standard that you do for yourself when you're going for your physical health. Now, you don't go to somebody who is not a medical doctor, right? You don't, or at least a nurse practitioner or a physician assistant, somebody who has that training, who is qualified. You wouldn't put your health in someone else's hands, right? You wouldn't go for heart surgery with somebody who's not a heart surgeon. So do not do that with your mental health. Treat your mental health with utmost respect. Now, as a believer in Christ, as a Christian, as a woman of faith, I am also a clinical psychologist, and I will tell you right now that there are folks who believe that in the faith community that all of our problems, psychological problems, whether it be depression, anxiety, traumas, thought disorders, delusions, whatever, that it all falls under spirituality. That is not true. That is absolutely not true. That is as untrue as your physical health being a problem, that a lack of faith on your part. That is untrue. And there are groups who teach that if you have something physically wrong with you, that's a spiritual problem and you're not having enough faith. That is garbage, garbage, garbage. The same is true with your mental health. If somebody tells you you have depression or you have anxiety because you're not in God's word enough, that is garbage, garbage, garbage. Throw it and kick it to the curb, because God has created us intricately. And we have things going on in our brain, and we can have problems happening within our brain, both chemically and anatomically, the same that happens in our body. We have problems that happen in our body that affect our mental health, and our mental health affecting our body. So we have these incredible systems within the human body. And when things go wrong in cattywampus, it's like we have problems. It is not a matter of spirituality. Now, with that said, I will tell you that the research out there, studies out there, strongly support the the idea that faith, a person's faith, can lead to better outcomes in their mental health, specifically fewer hospitalization stays, so mental health hospitalization, and shorter in duration. If they are hospitalized, generally speaking, the stays are shorter. Now, this is not data that's been collected solely by a faith community. This is just out there. So you can also do your own research there and check that out. But I have personally experienced it as a clinician. I have experienced people of faith, strong faith in the relationship with God, and they have definitely fared better, even though they have a diagnosis of clinical depression. They have a diagnosis of anxiety disorders. I have worked with and provided therapy for people who have a diagnosis of schizophrenia, people who have dissociative identity disorder, previously known as multiple personality disorder, which is a result of severe childhood traumas. So mental health, mental illness is a real thing. It is as real as our physical heart, lung, everything within our body. We don't say from here up in a mental health way is invalid. That is so not true. And I encourage you for yourself to do the research, read, educate yourselves, understand what is happening within the sphere of depression, anxiety, and other mental illness. Now, let me say a word here about thought, unhealthy thoughts. So, first, we educate ourselves, we understand what's going on with us. If we have depressive symptoms and depression, and again, that can be on a spectrum here of very minimal, mild depression to a major depression where we are experiencing suicidal thinking, and severe. We can actually be catatonic where we are incapable of any sort of involvement in life. Um, you can look at anxiety, consider it the same way. And when you look at the diagnoses of these disorders in the DSM, we can see that. We have anxiety that is just generalized anxiety. You'll hear it called as GAD, GAD, generalized anxiety. And then we'll have, more anxieties that fit along the line of like phobias, panic attacks, things like that, that can be excruciating and debilitating. Now, if you haven't watched my videos on anxiety and exercises, I encourage you strongly to go back to my first one because I teach you about the autonomic nervous system. I teach you about there are two branches to the autonomic nervous system, which is autonomic. It happens, now automatically, but there is the parasympathetic, which is where our body automatically, where it calms down. We're in that calm state. Parasympathetic, of course, is where we're in the fight, flight, or freeze mode. And that is where that heightened, and that's what happens when we experience elevated anxiety and where we experience panic attacks. That anxiety is off the charts and the sympathetic nervous system is kicked in. So I educate you all about that. And then I teach you some very basic skills called grounding and resourcing. I just teach you how to implement those and use those to really train your body to calm down and to settle down that sympathetic nervous system. So please go back and watch those. They are absolutely those skills that I taught in the beginning. I have taught those skills to patients and clients of mine that's literally transformed their lives, because as long as your anxiety is off the charts and has control, again, you will not be able to move forward and do the things that God has called you to do, that He has created you to do. You're not going to be able to live your best life if you have this anxiety that is debilitating. So please watch those. Now, I also made mention about the thought process. Well, I want to go a little further with that. And I want to talk about these unhealthy thoughts. And I have mentioned in our previous video about core beliefs. And so if you look at yourself and you kind of picture the core of your person, like maybe draw a circle on a paper and right on the inside of that, write core beliefs. Those core beliefs are beliefs that have been developed within you, within your core, within your person over the years, beginning in infancy and even in utero. Did you know research shows that the baby in utero, as the baby is developing, the baby can actually, as they're developing auditory capacity, all that, they can hear, they can respond, they can experience, experience if mother is stressed, if there's a noise. So this happens in utero. Excuse me. My throat just starts getting a little dry there. So then we have infancy, and there's been much research done on these things called neurotransmitters. And they're just these connections and firing within the brain of the baby, as the caregiver, mommy, daddy, caregiver are making eye contact and interacting, and there's this firing going on in the brain. So powerful and so amazing. So my point is, goodness, our person is being developed from very teeny tiny person that we are, these core beliefs are being developed. Okay. Now, if we are left in our crib to cry and not be attended to, if we are screamed at and yelled at, if we are not fed, if we are physically abused, if we are neglected, those things are going to develop beliefs within inside of us. And those beliefs are going to grow over the years. And from those beliefs, we develop thinking, patterns of thinking. Automatic thoughts will come up. And we have just hundreds automatic thoughts throughout a day, just automatic thoughts. Those thoughts are coming from deep within ourselves. So here comes the problem. When we are having negative thinking, unhealthy thinking, for instance, I'm going to give you a for instance here. That's a common one. I feel I am nervous to talk to people. I go into a crowd and I'm thinking down inside that I'm going to say the wrong thing or say something stupid. So I get anxious before I go to social events. I get anxious and I start avoiding those events. That becomes social anxiety. I notice that when I go out and I go places, I get this, okay, here's my sympathetic nervous system kicking in. Oh my gosh, my heart is pounding. My face is, I just feel it flushing. I feel my hands sweating. I just feel like I need to get out of there. I need to run. Because now I'm responding to my thoughts and those automatic thoughts that are deep in there about what might happen and what I might not be able to say. And that's coming from my core beliefs of maybe I was told that I was stupid. Maybe from my environment, where my core beliefs are developed, from my environment, I got the message that I didn't matter, that what I had to say didn't matter, or maybe I stuttered, or maybe I said something was silly and everybody laughed. And so then I learned from that early age to fear and to think that that I don't have anything good to say or purposeful. And so then that is turned into these unhealthy thoughts, these what we call distorted thinking. And that in turn affects how we're feeling and ultimately is going to affect our behavior and what we choose to do or not do, whether we're going to go out to that party or not, whether we are going to go out to that shopping mall or not, whether we are going to go and hang out with those group of friends or not, or if we're going to hang back and stay at home and become isolative. So, my friend, here's my question to you today. What are you telling yourself? What kind of thoughts? I want you to think about what you're thinking. And we call that metacognition, which simply means to step back and think about our thoughts. Think about how we're thinking. Think about what you're thinking. See if you can identify that. See if you can write those things down. And more importantly, draw a circle on a paper. And that circle is you. You can make it like whatever. See if you can identify your core beliefs. And this might be some hard work. It may take you a little time to identify that. But connect those dots. See if you can connect those dots. When we can identify those core beliefs, for myself, I grew up in a home with abusive parents. I had physical abuse. I had emotional abuse, verbal abuse. I was told I was stupid. I did not learn how to read. I was not helped as a child. And so I failed in school. I had a lot of trauma in my home. So I hid. I found places to hide at school, at home, and I just kind of disappeared into the background. And so I developed these core beliefs about myself that really just became a part of who I was, which was you're unworthy, you're worthless, you are stupid, you are a failure, you can't do anything right, you're not worth taking care of, you're not valuable. All of these things really made up the core of myself. And so, just my type of thinking, my thoughts, of course, my thoughts are going to be tied to those core beliefs about myself and the core beliefs I have about others. The world isn't safe. Don't trust anyone. Put those walls up. Keep everyone else out. It's just, it just is what it is. You know, they're so solid, those core beliefs in there. And the automatic thoughts that come up that nobody likes you. Why would you go do that? Why would you go hang out? Why would you go to school? You're stupid. Why would you go back to school? Why would you finish school? You're dumb. You can't learn. You're not worth it. All these things that come, and then what do? We act it out in our life. We ultimately act out what our core beliefs and our unhealthy thinking are. We act them out in our life. We make choices in our relationships. We make choices in our day-to-day going about doing. We make choices in how we treat ourselves. We make choices in who we allow in. We make choices about how far we want to go, how far we'll go in our career, how far we'll go in school, where we'll go, what we'll do. This is so powerful. And this is why I said, and I'm going to go all the way back now to the beginning of this video, which is learning how to manage our mental health begins with educating yourself about where you're at, what's going on with you, getting an accurate picture of that. And then how are those automatic thoughts and core beliefs influencing your anxiety and depression? How might those destructive thoughts, unhealthy thoughts, affect how you're feeling and in your mood and in your level of anxiety from day to day? Okay, so think on that. I hope this has been helpful for you. Please share this video, share it with people you know, share it with people that may be struggling. I really am so happy to provide information, just education, just to educate you. I'm of course not providing therapy because I don't have that relationship with you, but you can have that relationship with someone, a professional that you seek out. But I am simply here just to provide information and hopefully get you going in a direction where you need to go, because the truth is God has so much for you. He wants you to be healthy physically, emotionally, mentally, and he wants you to take care of yourself. He wants you to take care of yourself, not just physically, but mentally. And so spending the time to figure out what is happening with you, what might be going on, please enlist the help of a professional. You can go online and look in your area. If you have insurance, you can go through insurance, even state insurance. They can help you identify where you might have a psychiatrist, a therapist. I highly, highly, highly recommend, even if you have tried that in the past and you've not had good success, Please don't give up. Please don't give up. There are a lot of excellent therapists and psychologists out there. There are a lot of excellent psychiatrists out there. God wants you to be healthy because he has a plan for your life. He wants us to live our full potential. He wants to use our lives to bless us, to fulfill us, and to be used of him for his purpose and his glory. But if we are being held back by our anxiety and our depression, if we are held back because we have these core beliefs that are so destructive and so wrong, and so much so that they are affecting our automatic thoughts, and we have these thoughts of loser, 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 or you're worthless, you can't ever do anything right. If these thoughts come automatically to you, there's a reason for that. They're coming from within the core, and those can be dealt with. Those can be challenged. But we first have to identify them. We have to identify and get to what we're thinking and why we're thinking it. And then we can begin to challenge it. So, in our next video, I am going to share how to challenge those core beliefs, how to challenge the unhealthy thought process. So, how do we change? How do we change those core beliefs? You may say, Dr. Tammy, my goodness, I am this old. I've gone through my whole life with these core beliefs. How on earth can I change those now? It can happen. And by the way, God says that all things are possible through to those who believe. And he says that he gives us his strength. He will strengthen us, that nothing is impossible to those who believe. So not only will you have the skills to do this, and I'm going to teach you different things here, but you have God Almighty. If you have a relationship with him, if you have him as your Lord and Savior, my friend, there is nowhere you can't go. There is nothing that you can't overcome when Jesus says he is in your corner. And, you know, we may walk with a limp. We may have that depression and that anxiety that we are getting treatment for, and that we are walking with through life, and we may have this little limp, but it does not have to hold us back. It does not have to define us, because God is with us and he's going alongside us, and he will give us the strength we need. He will make the way straight before us, and we can move forward. And yes, mental illness is a real thing, and we must take care of our mental health, but we can absolutely learn how to manage our mental health. If you have clinical depression, you may have to stay on medication. If you have a diagnosis of trauma or schizophrenia or schizoaffective disorder or bipolar disorder, bipolar 1, bipolar 2, you are likely probably going to have to stay on medications under the supervision of your psychiatrist. That is okay. It is no different than if you had diabetes type 1 or type 2, but especially type 1, where you are having to regulate yourself constantly and you are having to give yourself insulin, right? There's no difference. Or if you have RA, rheumatoid arthritis, and you're having to take medications to control the inflation or the inflammation in your body. This is real stuff. These are real conditions. So are mental illness diagnoses. So is schizophrenia, thought disorders, mood disorders. So please don't make light of it. Understand that it's a real thing. And the most important thing is that you're able to manage it, you're able to identify it, so you know what you're dealing with. And then you can take care of yourself and identify where your core beliefs are in those automatic thoughts, and how you can identify and change them and manage so that you can improve your day-to-day. So that's all I have for you. God bless you. Thank you for listening. I'm Dr. Tammy. Please subscribe to my channel. Let me know if this has been helpful. Send me messages. Let me know what content you would like to hear. I am skilled and trained, highly trained and educated in mental health, mental illness. So we can talk about anything in that spectrum, and self-care, relationships, relationship issues. Please send me a message. Let me know what you would like me to cover, because I'm just starting here, and I am providing education on things that I know people are struggling with. But if you can subscribe to my channel and let me know, send me a message, let me know, hey, Dr. Tammy, I'd like to hear about this, or I'd like to hear about that. Please let me know, and I will make sure I cover that content. So, God bless you. And next time, we are going to talk specifically about those unhealthy thought patterns and how we change them and how we change those core beliefs. Okay? See you next time.